The meeting of the Board of Health to order. Please join me in the Pledge of Allegiance. I pledge allegiance to the flag of the United States of America, to the republic which stands, one nation, under God, indivisible, with liberty and justice for all. I'm Dr. Ed Weiner, Chairman of the Burlington Board of Health, and with me this evening are members, our Vice Chair, Ms. Gail Demore, and member Mara El Sabahi, and Mary Beth Welch and Andrea Sheehan could not be with us this evening. Our professional staff, Susan Luminello as Director of Public Health, Michael Green, Associate Director of Public Health, and our Environmental Engineer, Christine Mathis. And we have a recording secretary this evening.
She's not here, but I'm recording the meeting.
You're recording the meeting. Just for the record, our recording secretary is Ms. Julie Falkingham. Please note that we're live on and will be taped by BCAT and available for appropriate comments and questions through this video technology. And as always, thank you to BCAT for what you do for this community, keeping us all aware and so well informed. Thank you so much, BCAT. Our first order of business is approval of minutes. We have minutes for September 24th, 2024. Do I have a motion to approve?
Motion to approve.
I have a motion to approve by Ms. Dr. El Sabahi. Do I have a second?
Second.
I have a second, Vice Chair Gail Demore. All in favor?
Aye.
Aye. Thank you. Next is citizens' time. I guess you are both here because you have an agenda item, correct?
Correct.
Correct. Is there anybody online who would like to speak to this board?
We have, looks like one person now online, KF. I'm not sure if they're here for citizens' time or for an agenda item.
Whoever it is, you're on mute. Would you like to say something to this board? I guess not.
Okay. I'll send a message in the chat just to make sure.
You want to just do that and wait a few seconds?
And we also have somebody who came back on, RAR. We're just trying to find out if you're here for citizens' time.
Yes,
Okay, yes, they are.
Yes, okay. Please state your name and,
my name is Ruth Wren. I'm just here to listen, find out what's happening.
okay. Ruth, this is Ed Weiner. Thank you for joining
hi.
us.
Yes, hi.
We will be having a presentation that I think you are interested in a little bit.
Thank you.
Thank you. We'll go on to Chairman's report, which is going to be a little lengthy this evening, because I have some things to say because some people have asked me to report on some information. Tonight, I want to talk about influenza, the flu. First, this is not a political talk, but just some facts and updates as a member of this Board of Health. I've talked about this many times over the past years, and I've been asked to make a few comments this evening. Why I do this is because I find the information year after year both fascinating and rather shocking. Yeah, it's just a flu, right? Well, maybe not. The CDC estimates that 2023-2024 flu season last year in the United States resulted in between 17,000 as many as 100,000 deaths from influenza last year. And you worried about COVID. This includes a scary 199 pediatric deaths last year, which matches a record set in 2019-2020. Some estimates for last year's flu season alone includes numbers as high as 75 million illnesses, anywhere from 15 to 33 million medical visits, and some believe on the high end as 900,000, almost a million hospitalization. So the question is people ask me all the time, should I get the shot? Should I get the vaccine? Well, the CDC estimates that the flu vaccine prevented 3,500 deaths, 105,000 hospitalizations, 3.7 million medical visits, and at least 7.4 million illnesses from the flu. And near and dear to my heart, in recent years, it's estimated that between 70% and 80%, that's a vast majority of seasonal flu-related deaths have occurred in people 65 years and older. And between 50 and 75% of seasonal flu-related hospitalization have occurred among people, in my age group. So it's your call, your decision, your body, your life. The flu vaccine is available in many instances, if not all, without cost. It's available here at your Board of Health and almost every clinic and almost every pharmacy and every hospital. Well, personally, I'm a pretty darn bad gambler. Looking at the numbers, I don't want the flu, I got the shot. So all be well and make a decision. So, brings us to discussion. The first discussion topic is kennel license 16 Wood Hill Road. And I think that Ms. Alejandro Ramirez Santiago, did I say it right?
That's correct.
Please come up to the microphone, please, and please sign your name. I just print it, please, print it.
In here?
Yes.
Uh-huh.
You are with her? Would you like
Yes.
to join her? Sure, come up, be on television.
Thank you.
Director, who is presenting this?
I can. So this is for a recommendation to the clerk's office for them to get a kennel permit and they can talk a little bit about how many dogs they have, what types of dogs. Samantha Hardy went out, did an inspection, found no issues or concerns. So if you want to just say a little bit about your dogs.
Absolutely, thank you. So we have 4 small dogs. We have, there are 2 Chihuahuas. One of them is 18 years old, so we don't know how long she's going to be with us, but we hope many, many years. We have recently a Pomeranian and a miniature pincher. So between all of them, probably they weighed 40 pounds combined. And we were registering our youngest puppy, the Pomeranian, with the city, and they told us we needed to apply for the kennel license, which, we did, and we had the inspection. I think the officer, came and checked our house, the backyard, everything. They're lovely, beautiful, small doggies that we love very much. And that's pretty much it. So we have 4 of them.
Do we have any reports? Are any abutters or have anything to say?
No.
No comments from abutters? They are not barking at all hours of the night?
No, we actually keep them, they have a fence in, they have a fence backyard. They do go out. They do bark sometimes at neighbor dogs and people walking, but we try to, keep them inside. And mostly, in the night, we try to get them in 8, 9 p.m. the most.
Good, thank
Yeah.
you. Anybody from the board have anything to? Would you like to say your name? What's your name?
Angela, and I don't have anything to add. We observe the quiet hours in the morning and at night, and they're vaccinated, they're well-kept, they're registered. They mostly stay in the yard. They have a dog walker that takes them out. Other than that, they're inside of a 6-foot fence that they could never hope to get over.
They're very tiny.
Well, I have no questions, no other questions. So we're looking for a motion to send a positive recommendation to the town clerk.
Right.
So we have that motion from Ms. Demore, second by.
Approved, yes.
From Marwa. If not, any other? If not, all in favor? Aye.
Thank you. We appreciate your time this evening.
Thank you. Thank you for coming.
Thank you.
Good luck.
Good luck.
Thank you.
Under discussion is the one I have been waiting for, mosquito control with Brian Farless, who's the superintendent for East Middlesex and Suffolk County Mosquito Control. We've been doing this a long time. Oh, good. Welcome, Mr. Farless.
Hi, thanks for having me.
Thank you. We have, we do have your information that you sent along, and is there a presentation, or is this going to, what would you like to, how would you like to do this?
Yeah, so we don't have a particular presentation. The reason why we asked him to come here is because I believe it was the last meeting, there was some questions about the services that they provide for us and what, if any, additional services they could provide and how they do their surveillance. So I couldn't answer those questions in full, so I asked, or Christine asked Brian to come to this meeting to get, kind of just give a background on those things. So Brian, I don't know if you have anything, you want to just give an explanation of those things and then we could go with questions?
Yeah, for sure. Can you go back through those again real quick? Let me make sure I got I caught everything.
So
I'll write them down.
Yeah, that's the types of services that Burlington now receives.
Okay.
And what's involved with that, so that
Yep.
what we do receive currently is the helicopter larvicide spraying, the
Yeah.
truck-mounted mosquito spraying, the larvicide of catch basins, and the mosquito surveillance. So maybe just give a description of those things, and then when you discuss the mosquito surveillance, a little bit more about that. I know I think the question was, why are the traps where they are, but we don't, disclose, or you don't disclose where those traps exactly are located, and just a little bit more discussion about that. I think Gail had the question right about, do we need more traps, more surveillance? Also, the question with regards to that was, do you spray for residents' homes, which we had the discussion prior to this meeting. I talked to Brian, and they do not do that. East Middlesex Mosquito Control does not do that. There are other mosquito control projects that do it. They just don't do it. So I'll let Brian take it from there, and then we can go with any questions. And then the last thing, I guess, was additional services, if any, that you could provide, and, the board could discuss whether or not they're interested in that.
Okay. Yeah, no, that sounds good. Yeah. So we do. I'll just start with larval mosquito control. We do that 3 different, or I guess really more than 3 different ways, but 3 different main ways. One, every spring we do a big helicopter application where we're going over, we're doing the Vine Brook area, and it's a low-flying helicopter that's putting out BTI larvicide, which is a natural occurring soil bacteria, over about 72 acres in that area. And then we continue on to do the same type of work, but by foot, so going through wetlands, taking water samples, looking for mosquito larvae, and then putting down BTI once again, a liquid BTI out of a pump backpack sprayer as mosquito larvae are found. And then the third method is catch basin larval control, where we hire seasonals, and the full-time staff also helps. Just traversing all the roads in Burlington and putting a little packet of larvicide in each catch basin. And that's important because catch basins house the primary vector for West Nile virus. It's very specific. There are only a couple of different species in catch basins, and the primary vector in Massachusetts, called Culex pipiens, is found in the catch basin. So we do all of those in Burlington. Then moving on to adult mosquito control, we have a big sprayer in the back of a pickup truck, and as we have disease or high mosquito populations found by our adult mosquito surveillance, which I'll talk about next, then we could decide if we should do some adult mosquito control, which is basically spraying a large area with the sprayer in the back of the pickup truck, and that's knocking down the total population of the mosquitoes in that area. And how we determine how to do that is with our surveillance program. So our entomologist puts out traps. We have 2 different styles of traps that we're using in Burlington. One of them is a gravitrap. It's catching that mosquito that's the primary vector for West Nile virus. And then he takes those back to the lab and then puts them in little pools, and we take them to the Massachusetts Department of Public Health. Then they test everything for West Nile and Triple E. And then the other one is a light trap where it's baited by carbon dioxide. And then there's a light on the trap as well. So that's targeting mammal biting mosquitoes. And that's where we would find more Triple E carrying mosquitoes. So once again, our entomologists would take it back to the lab, speciate, put them in pools by species, and take them to the Massachusetts Department of Public Health. So how he determines where he's going to trap is he did this years ago, and it's a continual process. Most of the traps are near big wetlands because that's where we know mosquitoes are coming from. There are, of course, a lot of little wetlands, and they're of course coming from people's yards. But for like the light trap mosquitoes, the mammal biting mosquitoes, we're finding those coming out of the large wetlands. So he did that just years ago, and he continues to do it. We have a handful of trap sites in Burlington. We like to have historical traps. Sometimes we lose trap sites. Sometimes we'll have to get more trap sites if somebody moves or something, because most of our traps are in people's yards. So that's how we determine how to do it. And how often we trap is determined by is disease in the area. Like for instance, this year we had Triple E. So then we want to look at mosquito species, and if a place is having a lot of a particular mosquito species, and we want to concentrate on that area more. We have over 50 mosquito species in Massachusetts. There are a handful that we're worried about for Triple E. So we know, based on the trapping that we did previously in the season, this trap site has a lot of that one mosquito. We need to concentrate on that more if Triple E is in the area. So we can predict it a little bit on where to look for it, when to look for it. Like for instance, this year we had a Triple E issue in the state, and we knew it was going to happen because there was a good chance. We knew there was a good chance it was going to happen because last year at the end of the summer, early fall, Triple E started showing up in some mosquito samples, not in our district, but in other parts of the state. So then we know Triple E's around. We had high populations of particularly 2 different mosquito species, the Culicida melanura and the Coquilitidia perturbans. Those were very high. It was very wet last year. Into the fall, into the winter, it was very mild and wet. So their habitat didn't dry out. They overwinter in their larval state. So they need almost 1 year in their larval state, and then they come out as an adult. So if it dries out, if their habitat dries out, then they're going to die, which is great. But that didn't happen last year. So we had all the pieces were lining up. We had Triple E that was found. We had these mosquito species, high populations of them, and it was wet, and it never dried out. Into the spring, like, okay, here we go. We have a lot. So I guess, so we can focus on those areas more if it's a time with Triple E on when to trap. And then, let's see. And another thing that we do is education, just things like this, presentations. Our entomologist has been doing this since 2000. He has a PhD in bugs. He loves bugs. He's really good at it. He's very knowledgeable about it. So he does presentations at different times. And then another service that we do in our district We don't do it in Burlington as a part of our normal schedule of services. It's ditch maintenance. So starting in October typically and ending in March or April, we're out doing ditch work. So maintaining ditchways. And what that does is reducing mosquito habitat, therefore reducing mosquitoes. Source reduction. That's the best thing. That's what we all want to do, is just source reduction. If you don't have mosquito habitat, you won't have mosquitoes. We don't do that in Burlington. I think it's a good thing to do. So that's a service that we could add. And then we also do, which I didn't talk about, we do source reduction throughout the summer. Let's say there's an unkempt pool in somebody's yard, or there's something in somebody's yard that they can't empty, or they're working on getting it pumped out. But in the meantime, we can go put a larvicide in. Source reduction. And I think, oh yeah, we don't do any backpack spraying in residences' yards. We only do the truck-mounted spraying. And I think I covered it all. I'll open it up for questions.
First, the board, for staff, do they have staff any questions?
You go for, I just did want, while Brian is here, just to explain a little bit, maybe after your questions, about how mosquito control projects work in Massachusetts and how they work in conjunction with Mass DPH, because I think there is some confusion when, when Triple-E is around and people say there's spraying going on. That's not the mosquito control projects that's doing that, that's DPH. So maybe just kind of explain a little bit about how the mosquito control projects work and when DPH would step in. So I'm.
Okay, yeah.
Yeah.
Yeah, they're all set up separately, and we all have our own way that we do mosquito control. So, for instance, for us at East Middlesex Mosquito Control, each city and town chooses which services they want. Pioneer Valley is a newer mosquito control district. They also do that, but everybody else is a different funding system, and it's not choose your service, a la carte service. So we all operate. We all are doing basically the same thing, but we operate a little differently. So when there's Triple-E in the state and airplanes go up in the sky, that's a decision that's made by the State Reclamation Board, which is a 3-person board that oversees mosquito control districts. It's within the Department of Agricultural Resources. They're making that final decision, but they are working with the Massachusetts Department of Public Health as well as many other agencies and departments. It's a big decision to make when that happens. So anytime airplanes go up to spray for Triple-E, it's them doing that. We don't have any part in that. How we could help is doing extra surveillance, because you want to track before and after to look for control. And yeah, did that cover all of that?
Yes, thank you.
Yeah.
Do you have any questions?
I do. So I have a few. So, and I apologize, maybe I missed this. You had said there was something that it's not done in Burlington specifically, but there is a treatment that can be done?
Yeah, it's ditch maintenance. So basically we're not creating new ditchways, but we're just maintaining the existing ditchways. And we're doing that by hand tools, rakes, chainsaws, just pulling out debris from ditch channels, and to allow the water to flow as it was originally intended. And what that's doing is just reducing the mosquito habitat upstream.
Still
But,
water and all that, okay. And then,
Excuse me, that is controlled by the Conservation Commission that does the,
Yeah, so Ryan, before this meeting, Christine and I did have a discussion with Eileen Coleman, the Conservation Administrator. And, I know I talked to you, Brian, and you were like, oh, yeah, we don't usually get permission from Conservation to do that type of thing. However, she thought you would need permission from Conservation to do it, so it sounded like they would want us to let them know if we were going to be doing something like, because it is within a wetland, right? It's in wetland areas.
Yeah, and if the town wanted to do it that way, that's fine with us. We're just the contractor, we're working with the town and doing it. We can go in and do certain work in ditches and wetlands. We have wetlands exemption, so we don't actually need permission from the Conservation Commission. Although when we're doing one other thing we do is use an excavator and go in. When we're doing bigger jobs like that, we're always talking to the Conservation Commission. We're going to do site visits. We're going to talk everything out. But we just want to do it how the town wants to do it. So
I think, that in the past, the Conservation Commission has been very against the excavator
Yeah.
idea and bringing heavy
Which I
equipment.
Heavy
understand,
equipment
of
and,
course.
yeah.
I'm not sure where they stand on the ditch digging thing and the hand.
But do we have a lot of ditches?
I
Oh,
don't
I
know,
mean-
Brian, maybe he could.
We've got
could you
miles
find a
and
lot
miles
of
of
work
streams
to
over
do?
100.
Yeah.
If you,
Oh,
okay,
streams, okay.
yeah. So
yeah,
I
you
think-
have a lot of ditches, a lot of big wetlands in Burlington. So there's a lot.
So if that is something that the board wanted to, pursue further, we definitely would need to have a discussion with Concom and see how they feel about that, so.
Thank you.
Yeah, for sure. Yeah, we could just go over everything that we do, how we determine where we're working. A lot of times we're doing work in places where the town has asked us to do it too, so everybody's kind of already involved in it.
Thank you. Can I ask one more question?
Sure, please.
So what is your threshold for is it just one mosquito? If you find literally an N of 1 that carries triple E, then you would treat that area? Or what is the threshold for treating based on the findings?
For adult spraying.
Right.
Yeah. If we find triple E, we would want to spray.
Okay.
Because if it's there, if it's showing up in a mosquito, then we know it's kind of around a little bit. So we would want to try to reduce the population immediately.
Thank you.
Brian, can you just clarify too on that just a little bit with regards to the triple E? It's my understanding that the type of mosquito that carries triple E lives in a certain environment, and that type of environment is mainly in the southern parts of the state. Am I right on that?
Yeah, southern part. It is in some other parts as well. But Plymouth County probably has the most triple E historically, just due to the wetland habitat. It's like white cedar swamps, large red maple swamps, and then that's housing this mosquito called Culiceta melanura. It's primarily a bird-biting mosquito, so that's one mosquito species that we look for, and then if we have that and triple E, then we know we may have a problem. So that one comes out and it starts amplifying triple E within the bird populations, and then we have some bridge vectors that come out a little later in the season. So then if you have those, then they'll bite birds, get it, and then they could bite a mammal or whatever, give it to them. So Plymouth has a lot of that habitat. We have a little bit in our district. There's a little bit in Burlington. So we get a little bit of that Culiceta melanura. It's not a big number in Burlington. It's definitely more than closer to Boston, but it's not as much as kind of further out in our district. Pretty much within Route 128, you tend to not see that mosquito a lot, and it would be unusual to find triple E. So kind of closer to Boston, and then you're not going to have it moving out more. You're going to have it. So we have a little bit in our district, and then there's been some places in Worcester that have been finding it. Like the last outbreak in 2019, they were having quite a bit. And they also had a little bit this year, and then also they were finding it late summer and fall too. So you have some different spots that are coming up, but Plymouth is by far the biggest, I think. But it's all changing. Everything's changing. Weather's changing. Mosquito species are changing. The season starts earlier. It lasts longer. So that's for now.
Mr. Chairman, we did have a question from someone who's Ruth, who's online. She
We're going to
wanted-
ask the board first before we open it up to the community.
Yeah, she just wanted to know if he could just spell the name of the triple E mosquito while we're on.
Sure.
on it. What is the name of the triple E mosquito again, Brian?
Yeah, Culicida melanura. Can I write in the chat? Is that an option for me?
Yeah, you should be able to. Thank you.
Oh, there we go.
Yeah.
While he's doing it,
Well,
Mr. Moore.
this mainly came up because I had residents and neighbors asking. I live on the end of town that neighbors Wilmington, and Wilmington offers, it's either individual yard spraying or full neighborhood spraying. So that's what prompted me to start asking questions. And I understand that the coalition we're with does not do individual yards. Is there a way, if everyone in a neighborhood wanted a spraying, can they request that through the town to you, or is that not even something that you offer?
That, I mean, the town chooses the services that they want as far as like us being able to do that. I think that would be hard. That could be a slippery slope. It takes a long time to do that. We don't do it until sunset. We do it in between sunset and sunrise because we don't want to harm pollinators. So that could be hard for us to do operation.
do you have anything else?
Would, if a neighborhood was concerned, would they be able to request a trap in their area to see if there's a
Yeah, we could do that for sure.
I mean,
Everyone's willing for us to put the trap in their yard. We could do that.
and then from,
We couldn't handle then, like, you know, all of a sudden we have 40 neighborhoods requesting us to do that because we don't have enough resources to do that. We'll put out 16 to 24 traps a week, and then our entomologist has to identify them all and sort them and submit them to the Massachusetts Department of Public Health. So I guess that could also be a slippery slope. I just don't know if we don't have the resources to take on a lot, but we could definitely do a little bit.
So if a neighborhood felt that they were being overridden by mosquitoes, who would they would call us and ask you to take a look at that situation? How is that the process that you would endorse?
Yeah, we get calls all summer long, people saying that they're having a lot of mosquitoes. So at which time we could go out and look at the wetland. We could kind of look at the closest trap to that area. And then, you know, if it's looking at if they're already getting bitten by mosquitoes, they may already have come out of the wetland. But, you know, we could just kind of go look for mosquito larvae, put down BTI if they're a larvae, and then take a look at the closest trap. What are those populations like? And there have even been times when all of a sudden over the weekend, a bunch of people start calling and leaving messages in one area, like what's going on? There was a big hatch somewhere. So then we could go out and just, you know, we don't want people to get bitten, but go out and see, are there basically like, are there a lot of mosquitoes? Yeah, bite counts. We don't do bite counts, but just kind of are a lot of mosquitoes trying to land on me.
Yeah, I have a bunch of questions. First, you touched on global warming is changing the environment for mosquitoes in this region. Is that what I think you touched upon?
Yeah, absolutely. Just bigger precipitation events that, of course, is going to could create some bigger hatches of mosquitoes. Just being a little warmer, it's all starting earlier in the season and lasting longer in the season. So it takes a while for disease to get in mosquitoes, and then for mosquitoes to then it gets passed around the mosquito populations, and then for them start giving it to people or other mammals. So if they have a longer time to do that whole process, that's not a good thing.
Now, there are a lot of commercial companies now. We see their signs everywhere at everybody's lawns. And I have had a lot of complaints from beekeepers that they have been wiped out because of mosquito spraying. And they attribute that to the commercial companies, not necessarily your control project. Do you in any way work with any of those or regulate any of those companies whatsoever?
No, not at all. We're completely separate from them. I don't know one from the other. Yeah.
When you do truck-mounted spraying, what do you use for insecticide?
Right now we're using Zinovex E4 is the brand name, and the active ingredient is etofenprox.
I'm sorry, would you play? You broke up.
Oh yeah, the brand name is Zinovex E4, and the active ingredient is etofenprox.
I'll have to look at. And how
Yeah,
toxic?
it'll be on the notice. Oh, go ahead.
And how
Sorry,
toxic is that to humans? E4.
I mean, the EPA, it's EPA approved. It hasn't been found to harm mammals.
Now, the reason I bring that up is that there are people within our community who have allergic reactions to insecticides. When you spray truck-mounted, and I would think that would be the situation, how careful, or you could tell us how careful you are in making sure those areas where these people who have documented allergies to insecticides live?
Yeah, so we have an exclusion process under the Department of Agricultural Resources. So anybody can sign up to be an exclusion. And when they do that, we don't spray within 300 feet of their property. So we mark all those off on a map. We have 2 people in the truck each time we spray in order to, one, watch out for people. We don't, we want to turn the spray off if we see somebody. And then also to help with the exclusion. So they're following a map. They're giving the driver directions and keeping track of the exclusions.
Well, to that end, you spray 72 acres of wetlands in Burlington by helicopter. Is that a contract with a helicopter service, or is that your helicopter? And they spray BTI, correct?
Yeah, BTI, and it's a contractor. Yep, and it's a solid. It's BTI on a corncob granule, so they fly low over the wetland and drop the granules down into the wetland so that there's no drift.
So it's granules, it's not spray.
Yeah, that's right. Yeah, it's little pieces of corncob. Okay.
And we have over 50 mosquito species in Massachusetts. I've read quite a bit about, in Florida, Anopheles mosquitoes are coming back, and they're having problems with malaria. Do we have anything like Anopheles coming up towards Massachusetts at all?
We have some Anopheles mosquitoes. We don't have that particular one. And then malaria, I think it's more, more of a warm weather. Like there are certain diseases that are found more in warm climates, like malaria, Zika, chikungunya, dengue. Those we don't have here. They're far from here, I guess.
And the last one is just a curiosity. Do you work at all with the Massachusetts Farm Bureau? Do you coordinate anything with them?
No.
Okay, thank you. Thank you very much. I have no more questions. You've answered them all. We have anybody online?
Yes. I'm not sure she has any questions. Ms. Rinn, do you have any questions for Brian or the board?
I don't at the moment. Thank you.
Thank you. Thank you for joining us, Ruth. Thank you very much.
Sure, thank you.
Well, you have been terrific. Thank you so much for taking the time to do this. We haven't had an opportunity seeing you before, And thank you so much for coming. This has really helped us quite a bit, and as I'm sure we'll have more discussion with ourselves and maybe speak to you again. So thank you so much. Unless,
Yeah, reach out.
No,
terrific.
thank you, Brian.
Thank you.
Thank you very much.
All right. Yep. Reach out anytime if you have any questions or anything. I'll be here to talk about mosquitoes.
Thank you so much.
All right. Take care. Good night.
Good night. I thought it was great.
Yeah, it was.
I learned a lot.
Yeah.
So I'm so glad that he, and I'm glad that somebody in the community went ahead and joined us, so thank you very much. Which takes us now to an update on the abandoned bunkers at Northeastern University, 147 South Bedford Street. And this is going to be presented by our environmental engineer, Christine Mathis. And Christine, you sent us hundreds of pages. Thank you.
Probably the best thing to do is take a look at, I think it's the third page in the board materials on Northeastern, and it's the diagram of the Northeastern campus. And what we're talking about here, in general, Northeastern campus has 4 buildings / areas. They have the Costas Building, Elliott Hall, the Drone Cage, and the ICBM building, or the Mixed Use Research Building. And when they were expanding the campus to build the ICBM building, we asked them to look at the structural integrity of both the north and south bunker that you can see on that diagram. And just for a little history, back in the 1950s, the site was a Nike missile launch site, and the bunkers are underground concrete structures that actually housed the missiles. And so they're basically, large underground concrete rooms, and they have steel doors that open like this, and then the missiles would come up on a platform and could be launched from ground level once they were raised out of the bunkers. So that was active for about 8 years. I don't think, nothing was ever launched from Burlington. And after the Army decommissioned it in 1962, Northeastern University bought it and has used it as an educational facility ever since. When the Army decommissioned it, they disconnected a lot of the hydraulic equipment, but took out any hydraulic fluids, that type of stuff. But the equipment actually is still in the bunkers. It's just not obviously active. So the current state of the bunkers is that they've been in the ground for 70 years. They are, for the most part, full of groundwater because they leak. And back in 2019, when Northeastern was looking at this expansion, we asked them to do a structural integrity assessment of those bunkers to make sure it was safe for regular traffic and or construction vehicle traffic, fire trucks, that type of thing, to drive over top of the bunkers. So they did that initial assessment in 2019. That's part of your package. And that initial assessment found that while the concrete box of the bunker was structurally sound, there's a little concern about the structural integrity of the steel doors and their reinforcement that's at the top of those bunkers. And they said that it would be best to restrict access over the bunkers. So the board at that time voted to allow that as a practice going forward. Northeastern put a structure around the north bunker so you can't drive over it or park on it. And the south bunker is now covered by landscaping. It's sort of like an elevated grass area that leads up to that new building. So in any event, you can't drive over or park upon either of the bunkers. One of the board's conditions at the time was that Northeastern revisit the structural integrity assessment every 2 years. This is their third, they did the initial 2019 assessment, they did the one in 2022, and then the one this year. This year's findings were that there's little to no change in either the structural integrity of the concrete and little to no change in the structural integrity of the steel doors. So they had originally, the engineers had originally proposed a 5-year look at the steel or repair to the steel doors. They moved that out another 5 years and said that there's been virtually no deterioration over the 5 years that they've been looking at the steel doors. So that reevaluation will take place in 2029. Any questions?
I have one question,
Please.
just because maybe I haven't heard about the whole
Sure.
scenario before. So is it that there is potential future use for that land or that area that these bunkers are currently in? I mean, are we looking to eventually replace this, or?
So Northeastern had mentioned a while maybe using the bunkers for research
I
purposes.
see, okay.
I don't know what the current status of that is.
Yeah.
It would be, I think it's extremely not cost effective to, for example, fill them. You know, to put in the amount of
Right.
clean fill that you would have to put in to fill them. They're quite large if you look at
I
some
see, yeah.
pictures. I mean, if
Yeah.
you, as you've read in the report, you know, when they do the structural integrity, they send in a dive team. And, because, you know, they're full of water, you can't access the control rooms anymore because the water's above the door, and, yeah, so they have to
Yeah.
do a confined space entry, send in a dive team, and, but it's quite an undertaking to do.
I think they did it by
assessments.
drone this year.
They did it by drone, I went back and I looked, they did it by drone on the initial assessment. They made an entry, but they also did drone assessments in the initial assessment in 2019 because they pumped them dry in 2019.
Oh, my gosh.
So that was a huge.
That must have been a huge
Because it's
undertaking.
like multiple, you know, Olympic-sized pools worth of water in
Wow.
these things. Because the groundwater, obviously, you know, it's gonna fill up in them. And, so, but I think the 22 assessment and this assessment was done by dive teams. Just because the undertaking of trying to pump them dry and get somebody in there is crazy. So anyway, yeah, they originally were looking at filling them, but then they said, you know, maybe these would be a good, they could have some research value down the road, let's keep our options open.
I see.
And
Thank
that's where
you.
we landed, that's where the board in Northeastern landed on the periodic assessments.
Gail, do you have any?
No.
I have a number of questions.
Sure.
What sort of hit me is the same thing that bothered me 5 years ago, was the fact that there's a lot of equipment still down there, a lot of equipment that's deteriorating. They are enclosed boxes, so any of the breakdown of specifically the electrical equipment is not going to go anywhere into the
Well,
ground?
I think they stripped like all the electrical equipment. What you see down there in the pictures is just the, you know, the metal pieces that are left.
Right,
of the
they're like
equipment.
corroding.
I think they stripped the electric, and I know they took the fluids out.
They did, okay.
Back in the 60s or whatever.
As you remember, we even required them to have a radiological survey
I can imagine.
because we didn't know what was in there
Years ago.
Yeah.
years and years ago. This has been going on. You know, Northeastern bought other Nike sites too. The most magnificent piece of land in probably the Northeast is their Nike site on Nahant, if you've ever seen it. And I've been there a number of times. In fact, 45 years ago, I took a course there. But they have completely used those bunkers for research purposes, and they've done a magnificent job with them. The only other question I have is, I'm just afraid of a fire truck, and they talk about that all the time. If a fire truck goes over the doors can't hold a fire
Yeah,
truck.
you can't drive anything over there either right now.
Is it
It's
real?
enclosed.
I have not been over there.
Yeah, so the north bunker, if you look on the screen, that's completely enclosed by a fence that's tied into the
Okay.
parking lot. And the south bunker, it's like a mounded hill. I mean, if you bought about a fire truck, if you tried to drive it up on the hill. And then there's
Okay.
bollards all in front of it, so you can't access the real estate above either of the bunkers with any vehicle, never mind a heavy vehicle like construction or fire truck.
So the number one question is that I'm going to ask the environmental engineer, are you satisfied with this report?
I am.
Thank you. Do we need, Ms. Director, do we need to take any action whatsoever, or this is just a,
Yeah, no.
this is just
Just an update.
Just an
Right, just
update.
to update the board, and in the future, if we did see any problems or concerns with the report, we certainly would bring it to the board, let you know. But in this case, we wouldn't normally have brought it, except that we just wanted to update the board members as to, what it is.
we live in a
What
strange,
piece of history?
It is.
well, we live in a
interesting,
strange
actually.
world. I hope we don't need those bunkers again. That's not an editorial remark, but, okay. The next is Board of Health regulations for stormwater and runoff management, and this should be presented by Ms. Christine Mathis, our environmental engineer. I'm going to ask the board, could we please postpone this to our next meeting? We don't have a full board this evening, and I think this is very important that the whole board hears this presentation, because in December, the Conservation Commission is coming to present what they would like to present to town meeting, and I think it would be appropriate and important for other two members who couldn't be here this evening to hear it. So I'd like a motion to postpone this to the first meeting in November.
I'll make a motion.
A motion by Mr. Maury,
Motion approved.
second by Dr. El Sabahi. All in favor? Aye. Okay, which takes us to staff reports. Environmental engineer, if there's anything else for the environmental engineer.
Couple quick things. We had household hazardous waste at the end of September, and we had relatively moderate day, 340 residents, it was smooth. And then I just wanted to update you on mosquito testing and surveillance has ended for the season. It ended on October 10th, and the state lowered the risk level for any communities that were at critical or high for triple E back down to moderate because of the absence of any suitable transmission vectors. Those mosquitoes aren't out anymore. And in their final agorovirus report, the state said that West Nile virus would continue to be a problem until the first hard frost. But based on the data I just looked at today from the NOAA facility at Hanscom Air Force Base, we had our first hard frost, or at least Bedford did, last week. So hopefully we're clear of mosquitoes for the season. Any questions on the rest of the report?
Evan? I do have a couple. You talked a little about septic systems on 10A. How many septic systems we have left? Any idea, ballpark?
About 65, 70.
Really, that many? Okay. Also, decommissioning the Vine Brook water treatment plant. Are you involved in that?
I've just been, so they have to commission the water supply wells under the Board of Health, private Board of Health well regulations. So I've just been working with DPW on facilitating that.
Is that completely going away?
Yes, that facility is going away,
Okay, good, thank you.
and those wells are being decommissioned.
They are all decommissioned.
As far as I know right now, that's the plan.
Okay. And any new biotechnology institutions? I know we have 21 now coming. I thought we would have one this month, the next one.
Well, we still have Vericel coming to the other half of the building that the Broad Institute is in. I expect their applications to probably come in around the first of the year, maybe January, February. And that's,
Is there a perk in Elmer?
they had some conversations with Mike and I, but I haven't heard from them in a couple months. So I don't know if that's still it works or not.
Okay. That's all I have. Do I have a motion to approve the environmental engineers report?
Motion to approve.
I have a motion by Ms. El Sabahi, second by Mr. Mori. All in favor? Aye, 300. Associate Director of Public Health.
Good evening, Chair, Board. Just wanted to bring to your attention, I've been putting together an application for the NACCHO Operational Readiness Award. That's a $5,000 grant for the MRC. And we're looking at doing personal and community preparedness and putting together kind of emergency preparedness bags with small items to get them started on their emergency preparedness path.
Who would get whom started? Members of the MRC?
Members of the MRC and possibly, depending on prices of the training, members of the community as well. We talked to the CEO of Safety Analytics, retired Lieutenant Glenn Mills, and he offers a number of classes in that regard, so we're trying to put something together.
He's very good.
Very good.
He's very good. Any questions? How did CarFit go?
CarFit went well. A bunch of our technicians, I think we had 6 new technicians trained, were able to participate and evaluate. I think we evaluated 6 members of the community, and then we had 2 of us run through for extra practice.
Thank you. And last, you met as the MRC coordinators meeting Brookline and Burlington. And why Brookline?
So the MRC kind of regional coordinator likes to pick on us a little bit because Brookline and us, as you know, are the only 2 single community MRCs. So he approaches us, this is Eric Olson with Cambridge Health Alliance, he approaches our 2 MRCs a little differently than the larger multi-community MRCs, and that's mainly due to, I think we're a little, how to say, a little easier to manage in a lot of respects, just because we do maintain just one town. So he looks to us for, inspiration and ideas and to help the other organization, especially the new units in 4A. Those 3 new units are really just starting up now. And they've had some turnover issues, so we're really trying to help them out.
Good, thank you. That's it. Motion to approve the Associate Director of Public Health. Motion by Mr. Mori, second by Dr. El Zabahi. All in favor? Aye. 300. Now, the Director of Public Health, that will include the supervisory nurse, the health agent, the associate health inspector, and then the director. So, under the supervisory nurse, is there any questions? I just have one. When are we going to introduce her to the community? I would like to have her to come to a board meeting.
Oh, Sandra?
Sandra, before the end of the year.
Yeah, she wasn't able to make, actually, she was the last one, but I can talk to her about coming maybe in November or December.
That would be fun, one of those 2 meetings, and just introduce her to the community. She's very well-spoken, and she's just so professional. I would like the community to see her, although she said she's met a lot already.
She has.
Yes, but it would be nice to do that publicly. Okay, so that is the supervisory nurse. The health agent, are there any questions about the health agent? Nope, I do not have one either. Do you have any? Nope. It takes care of it. The next one is associate health inspector. I don't have anything, which brings us now to the director of public health. A number of questions, but please, you go first. Do you have anything, Marla?
Not off the top of my
Do you
head.
have anything?
Not that I have note of, no.
First, we hired an administrative professional. I want to formally thank Joanne Faust for helping us out, as she always does. She's our Director of Human Services, and if anybody's watching, tell her I mentioned her name. And who is it?
So her name is Deb Boyce-Furt. She started this week, so today was her second day, so she seems to be enjoying it, and we're happy to have her. And thank you to Gail for helping us with the interview process.
I was on the
Thank you.
subcommittee.
I know that. I'm sorry.
That's okay.
Thank you for Gail, so the Vice Chair Gail Demore. Thank you very much. I think it's a lot of work. Thank you. The next one, how is the children's vaccination program going?
So it's going very well. We used to have the whole big clinics and, we'd go to the schools but now that we have Sandra, it's going very smoothly, where she's been able to contact the families, and they're coming into the office, so she's vaccinating them in the office rather than us having to go out to the schools and everything. So it's, because she's bilingual, it's very easy for her to communicate with them, so it's going very well. So, yeah, I have had no issues with that at all.
Which brings us to the last one as far as bilingual. We have a new person in the Triton group, Tri-Town group,
Yeah.
who is going to be managing our IT website.
Yeah, so her name is Yanisa Edwards, and her official title is Health Communications Specialist. And part of the Triton's requirements for next year is to do a website, strategic plan, and work on communications. So Yanisa is going to be, we've actually are going to be using Civic Engage, which does the town's website, but we're going to create a website just for the collaborative. So Yanisa is going to work with myself, Mike, and Sarah on that, and probably Katie Capabianco too, to create a website for the coalition. So we're just working, Yanisa is working on trying to get some stuff together and maybe design and that type of thing to give to Civic Plus so we can get something going. She's also going to be working on communicating between the communities, because that has been an issue between the staff in Lexington and Wilmington and the directors there, and how do we all communicate, and how do we, figure out what they need and that type of thing. So we're glad to have her. This is she just started last week or week before, so she's new to the position, and she's just kind of starting up, so.
So when we have an opportunity, if you happen to be available during the day or later in the afternoon on Wednesday, we have a lot of new people. So,
Does the Tri-Town Coalition meet regularly?
So the advisory board, which is the 3 directors of the town, so myself, Joanne Belanja, and Shelley Newhouse in Lexington and Wilmington, we try to meet on a monthly basis. That's a requirement in the municipal agreement.
I didn't realize it was that much.
Yep, and it's all, open meeting law, and so all the meetings are posted and everything. And Katie Capabianco, who's the shared services coordinator and the admin for the department, handles all those postings and everything. So, yeah, we try to meet regularly on that, just so that we can, keep them updated and that type of thing.
well, they're all in the office upstairs. As chairman, I go and see them every week, once a week, and check in with them. And it's a wonderful group of individuals, professionals. So thank you. Thank you to Mr. Green and Ms. Luminello for putting that together. It's working out beautifully. So thank you.
A good thing.
Yeah, this year we're going to be, right now we're reviewing the proposals for the strategic plan. So we're going to be hiring a consultant to put together a strategic plan for the next few years, so we can figure out what we need to work on.
Do I have a motion to approve the Director of Public Health report? Unless you have anything else.
One more thing, I just wanted to let you know that for Wildwood, they have vacated the property, so
Yeah,
that.
we saw
they will
that.
be back.
Yes.
Wow,
Again, do I have a motion to approve the Director of Public Health report?
so moved.
Mr. Maury,
Motion to approve.
Dr. El Sabahi, all in favor? Aye, 300. Is there anything else? If not, do I have a motion to adjourn?
Motion to adjourn.
Dr. El Sabahi, second by
Second.
Ms. Maury, all in favor? Aye, 300. Good night, everybody.